Hi folks, this is Dr. Ben Pandit. So welcome back. This is another lecture series video for Bio 202, Anatomy and Physiology 2. Okay, so I try to keep these videos shorter than last time, so you won't have to watch like an hour worth. So I'll try to keep it a little short. I'm probably gonna make like 3 sections of the respiratory. So when you're viewing these videos, you're gonna have 3 separate sections, okay, to explain you regarding the respiratory system. Okay, so first section is we're gonna talk about anatomy. Okay, so today this is just a reminder, and I'll remind you again for your respiratory and urinary, so our unit 4, these are the things that you should be doing. Okay, so your lecture, for your lecture, respiratory quiz is due on April 19th at 11:59. For urinary and unit 4 quizzes are due on April 26th at midnight. And your preview assignment is also due on the 26th. Your urinary and your respiratory, both of them are due on the 26th. Your lab lessons, spirometry lab, and spirometry lab assignment, that's the quiz one. The lab lesson is the paper. So those are due on the 19th at 11:59. Lab Unit 2 practical is going to be from 24th to 26th, and Unit 3, actually not Unit 3, sorry, I'll fix that. Unit 4 exam will be on May 1st to May 3rd. Okay, May 1st to May 3rd. That's Unit 4 exam. So just to get things started, before we talk about the structure of the lungs, especially nowadays, this become very important in terms of with pandemic that's going on. So how much water do you lose from your breathing? Take a few seconds. You could pause this video as well. What is the world record time of holding breath underwater? Think about that. Can you guess what that is? Okay, just yell out a guess. Okay, so you lose about 0.59, so 0.59 fluid ounce per day. So you lose every time, actually not per day, but every time you breathe out. When you breathe out, you do breathe some water out too from your breath. Every breath you take, every breath you breathe out, you actually have 0.59 of fluid ounce of water that comes out. The world record time, actually this guy broke his own record twice, I believe. Now is 22. If I'm correct, I think there's a new record to that. 22 might be what he did before. I think now it could be up to 26, but I'm not sure. I know he broke it a couple of times. But technically speaking, it's not fair to say that that's actually he's doing it all by himself. He's kind of cheated a little bit. So usually when this guy go underwater and trying to hold his breath, not to take away what he did, he's actually practiced and trained for this, but what he did was every time he does that, he actually breathed in a lot of oxygen. So pretty much he saturated his lungs with tons and tons of oxygen before he goes down under and then holds his breath. Normal folks like us, without having that oxygen or saturating your lungs with oxygen, you probably will be run out of breath within about 2 to 3 minutes, the most. There are some people who train to do this that could go down even longer, like 5 or 10 minutes. But without any saturation of your lungs with oxygen, you probably won't hold your breath that long. But the reason he held it that long because he literally breathed in a high amount of oxygen to the point that he have those oxygen to use up for 22-26 minutes or so. So the first part, we're going to talk about what respiration is and also the structure of the anatomy of the lungs. Okay, so respiration is literally means the exchange of the gas. When the gas going in and out, okay, exchange of the gas. External referring to between the air and the blood in the lung. So think of the lung is outside, is connected to outside of air, because you have this tube connected from the outside. So when you breathe in the outside air into your lungs, and you exchange that part from the outside air in your lungs. Whereas internal is between your blood and your tissue. So you exchange the gas between your blood and your body tissue. And cellular, even smaller than that, exchange your gas between your cells, the chemical reaction inside your cells, what happened in there. So when you have, when you learn about bio 181 or 182, where you learn about the mitochondria and cellular respiration, meaning that you have then, converting your pyruvate to in a Krebs cycle, and then you converting the NADH into ATPs, all of those using oxygen to actually create energy. Okay, so that's stuff that's going on inside your lungs that you cannot see usually. So this one is on the outside, is between your lungs and your blood vessel and your lungs. This one is in between your cells and your tissue and your blood, bringing to your cells. Breathing is referring to ventilation. Ventilation is movement of air in and out of your lungs, that's called breathing. You have the external versus internal. External is what's inside your lungs. This is the external. And what's internal is is the cell part, exchanging in the cell. That's the internal part of your respiration. You also have two tract. You have the URI, or I is referring to infection. So URT, which is upper respiratory tract, and then LRT, lower respiratory tract. Okay, so you have two section on the top. Okay, you have these section on the top here. So anytime you have any congestion up here, so you have like sore throat, you cough, you have sinus problem, you have mucus coming out, all of those are what we call upper respiratory infection, upper respiratory tract infection. So URI. So lower respiratory tract is from your trachea down, so anything that's inside your lungs, that's the lower respiratory tract. Okay. So conducting zones and division and respiratory division and zone, you have your nostril to the bronchioles. So you actually have the conducting zone. Conducting is meaning bringing the air in. Okay, bringing the air in. This is where the air comes in from your nose all the way down to your bronchioles. Okay, whereas the respiratory, this is where the gas actually exchange. So the only place that where gas actually exchange is in your alveoli, Okay, so that's the little air sacs. So when you think of respiratory division zone, think of is when the actual exchange happen. When you're conducting something, that means you just kind of think of a traffic. You're conducting a traffic light. You just think of a cop. So you just telling the traffic to go one way or out the other way. So that's conducting the air coming in and out. So from your nose all the way down to your lungs, that's just conducting a traffic. And then inside your alveoli, that's where you have the exchange, the actual respiration happen, respiratory division or zone happen. Okay, your nose is very special, very, very special. The key function of your nose, the reason we tell people to breathe through their nose is that your air, the air that goes in, you have these concha, which is right here, nasal concha. These, you have the superior, middle, and the inferior nasal concha. These are a bone. You have 6 bones in your nose, 3 on each side, to help warm up the air. So you want to warm up and moisten that air. So that's why you breathe through your nose. This will create what we call turbulence. turbulence. Just like the one in the airplane. It make the air kind of go crazy in here, which what it does is actually warm up that air before it goes down into your lungs. It will help with your lungs and also pick up any bacteria, any stuff, there's hair in your nose and other things in your nose to prevent things from go down deeper. And that's why we recommend to breathe through your nose. Okay. And this is also the place where you make your voice very, very special. Okay. The differences of the voice is not because of your throat, it's not because of your vocal cord, but it's rather up here. Is the structure, all of the structure of your nose and your sinuses, okay, in your face, that actually put a little stamp of that voice, of that you make your voice very unique. Okay. So nasal concha, like I said, these are the 3 bones that actually help warm and turbinate the air in your nose. Something you should know because it's actually on your exam. You should know that. Meatus are these creases. So the meatus is the crease between the concha. Concha are these pop-up stuff that you're seeing it kind of protruding out. Those are the bone. The concha is the bone. Nasal conchae. Conchae is 3, like plural. So nasal concha is singular, is these bones right here. Meatus is all these creases. Actually also help with that turbulence, keep the moisture in your nose. Okay. Interestingly, also just to mention, especially with dealing with COVID-19, this right here also help your nose, help make sense of your food in terms of your tasting different food. Because of the olfactory guide, there's actually olfactory nerve up here, olfactory bulb and olfactory nerve up here on the top part of your nose. For some reason, the coronavirus affects this part. Apparently, majority of people who has coronavirus lost the sense of smell. So that's one of the telltale sign. If you lost a sense of smell and cough, and you have those cough and fever, more likely you could have coronavirus. Okay, so it's up here, which affects this part of your body as well. Olfactory mucus, respiratory mucus. Okay, so these are the lining of your nasal cavity. These are the think of a coating around your nasal cavity. They put these coating there to actually help detect odor. It helps detect, like I mentioned, causing mucus. If that's the great thing to do, to trap any type of bacteria or any type of bugs going into your nose. Okay, so 33% of patients who have COVID-19 have a nasal discharge of sputum. So 33%. So this means it's affecting these cells as well. These cells are working by trying to trap those bacterial viruses and then make sure you kind of spit it out or it'll come out, so it won't let these guys, the bad guys, go into your body. Okay, so mucus, again, if you remember from your last chapter, your digestive system, mucus is created by goblet cells. So the same thing from your stomach. Goblet cells also produce mucus in your nose. Okay, so trap any bacteria. Lysozyme, again, Lysol is killing bacteria cells. These actually have enzyme destroying bacteria cells. There's 3 structure of your pharynx. You have the nasal pharynx, which is by your nose, nasal nose, oral pharynx, that's by your mouth, and then laryngeal pharynx, which is by your voice box. Larry likes to talk. So you have your voice box here in the front, right here. This is the voice box, and you have this laryngeal or larynx back here. So if you have laryngitis, more likely you cannot talk because this part of your throat is hurting, is swelling. So you have infection down here in this part of your throat, so you won't be able to talk. So a lot of time, you hear someone have difficulty talking and speaking because of a cold or flu. You're gonna say, "Oh yeah, you probably have laryngitis because it affects that part of your throat." Okay. So nasopharynx up here, oral, which is here, and then laryngeal is down here. Okay. Another key terms you need to know, we kind of covered this in digestive system already, is epiglottis. Epiglottis. This is blocking food to go down into your trachea, making sure that the food that you swallow doesn't go down into trachea. Glottis is the opening of the larynx. So you have the epiglottis, which is up here, and glottis is right here, going before you go into the larynx and into the trachea. Okay, vocal cords. These are vocal cord, one of the hardest working structure in your system. Okay, right here, this is a vocal cord. There are two types of vocal cord. There's a true vocal cord and a false vocal cord. So, okay, true vocal cord is here. Okay, vocal cord. This is a true vocal cord, and you have the false vocal cord, which is the vestibular fold here. Okay, so when you make a sound, and you guys could watch these videos, how the sound actually created. This one is really cool because you will see a first look of sound in Aerosmith lead singer, I forgot his name, Tyler Smith. Yeah, Tyler Smith. You're gonna see his vocal cord vibrate, hitting each other to make sound. Okay, that's how we make sound. You using these just a two little ply muscle to slam it together to actually make sound, different sound by changing the vibration of that muscle. Okay, so that's how you make sound. Imagine that if you talk all the time throughout the whole day, you actually could, that two thing could be hitting each other millions of times each day to make sound. So that could kind of cause wear and tear on your vocal cord. That's a lot of time people who talk a lot, like salesman, lawyer, or even the singer, they actually have vocal tears where these vocal cords slam too much to the point it start bleeding, start to break down. So trachea is a tube from upper part of right below your larynx all the way down. Okay, so trachea is a C-shaped ring. C-shape, you could see right here, is in the front. Okay, so the C, the opening part of the C is toward your back. Okay, toward your back. But the curved part of the C, the curved part here, is in the front. So the C-shaped ring of your trachea, you have these rings one by one going down your neck. Okay, it's a cartilaginous, which means it's just like your nose. It's a cartilage just like your nose. This is when you do tracheotomy, you could just cut it open because it's nice. And if you cut on the ring, it would be harder time. But if you cut between the ring, you could actually insert stuff inside there pretty easily. Trachealis is the muscle that between the gap on the posterior side. So trachealis is not in the front. In the front you have all of these cartilages in the front. Trachealis is in the back, and you could see esophagus right behind there. So this is where food goes in, this is where air goes in. So you have two different pipes going down your neck. Okay, one for food, one for air. And this is one of the biggest things to remember, and most people don't remember this, and this has become very important, especially right now what we talk about with COVID-19. Your trachea has another defense mechanism. This is part of how your body defends any bugs going down to your lungs. It has a little escalator. Escalator, yes, you heard it, escalator. So this is little hair-like, what we call mucocelia. Okay, mucocelia. These are hair-like stuff that actually moving the bacteria or any foreign material upward, going upward. So let's say you have the virus coming down to your throat. Some people might be able to catch this by the cell on the side, and then just keep kind of tossing think of it playing a game of hot potato. Hot potato or beach volleyball, you just kind of keep hitting that virus going upward instead of going down into your lung. Just keep hitting it all the way up to the outside. You could actually cough it out. Okay, so this is one of the defense mechanisms that your body does to actually prevent things going down into your lungs. So if you have like bacteria or mucus viruses or fungus that are trying to get down there, you actually have these working very well to bat it all the way up and outside your mouth. So imagine if you actually a smoker, you constantly smoke all the time, or people who have constant bronchitis or asthma. These escalator may not work for them, so they are higher risk for the virus to go in and going down into your lungs. Okay, so keep that in mind. So you have the larynx here, you have the trachea. This is a little review of anatomy that you should know. Okay, the split, when the lungs split, you have something called carina. Carina with the C, just sound just like a girl's name, Carina, not with the K, with the C. Carina, C for carina. Just always remember, carina, C for cough. Okay, cough, carina. Carina likes to cough, so cough. So anytime when things hit that point, this is where it bifurcates, meaning that it actually where it split into two. So carina, where it split to go to the left and to go to the right lungs. So carina split and then cough. So when it hits there, it actually has a receptor to cough up stuff, to cough up things. So let's say if you were to aspirate, meaning happen to just laugh and talk at the same time, and then water gets, and then start drinking water, and that water gets down and hit that spot, that's when you're going to start coughing up the water. So that's when you and you're trying to cough up that water. So this carina at this specific spot, it has a receptor that causes a reflex, a receptor that actually would cause you to cough things up. Okay, anytime things get down to that point, you're just gonna hack it up. You're gonna try to hack it up. So carina, coughing, splitting. It's going to the left, to the right. Okay, so splitting. The first part is the primary. Primary means one. So first is the primary. Okay, so primary bronchi, bronchus or bronchi. Bronchi is plural. Bronchus is singular. After it's primary, then it goes into secondary. Secondary meaning two. So after the first one, first degree, then you go to the second degree. Okay, so primary, secondary, and then you're going to tertiary, which is 3. So the third step, you're going from big, smaller, smaller. So think of 3 branches. You have first big branch, then you go to a smaller branch, and then you go even smaller branch. So primary, secondary, and tertiary. Okay, so remember that. So primary bronchus, secondary bronchus, and tertiary bronchus. And then you're going to go into terminal bronchioles. You're going to go to bronchioles and then terminal bronchioles. Bronchioles just like artery to arterioles. Arterioles means smaller, even smaller, minute. And then you go into terminal bronchioles at the end. This is where the bus stop. This is where you're gonna exit. No more railway after this. This is the end of the line, folks. Terminal, that's mean the end. Terminator, that's mean it's the end. That's why you get killed by these robots. So Terminator, terminal, which mean at the end. Okay, terminal bronchioles, that's where you stop. Okay, and after terminal bronchioles, you get into little sacs, air sacs called alveoli. Okay, alveoli. This is a very, very beautiful picture. This is really hard to do. You dissect this out. You have to clean the lungs very carefully. It could take months to do this. So this is a beautiful, beautiful picture of all of the lung surface. Another thing to mention really quickly, the lungs. You need to know this for your lab. You have this on the video for the lab video, but on the right side of your lungs have 3 lobes. You have the superior lobe, middle lobe, and then inferior lobe right here. Okay, on the left side of your lungs, you only have two lobes, superior lobe and inferior lobe right here. Okay, so the difference is the right side has 3, the left side has 2. Why does it do that? Why aren't we symmetrical? Well, what's on this side? What's take place on this side? So majority of this side, you have the heart. The heart actually take place there, so the lung does not divide into the third section on the left side because you have the heart there. Okay, what separates the lungs is the line. You have these what we call fissure. You have the horizontal fissure. Okay, horizontal fissure, and you have oblique fissure here, oblique fissure, horizontal fissure, and oblique fissure. So horizontal, which is on the top, and then you have oblique fissure here. Same thing, you have the oblique fissure here, you have the base of the lungs, and you have the apex on the top. So all of these terms are the term that you're required to know for your lab section, so make sure you know that for your lab, okay? So alveoli is air sacs. This is where the gas exchange happens. Think of grapes. When I think of alveoli, I always think of grape. Okay, alveoli. Alveolus is 1. Alveoli is more than 1. Alveolus is 1. Alveoli is more than 1. So this is where your gas exchange happens. Looks like grapes. Tiny little grapes come sticking one onto next to one another, making a little ball. Okay. This one, mark this page. You need to know this. You definitely need to know this for your exam. Okay, so type 1, squamous alveolar cells. Squamous alveolar cells. This is a function to do gas exchange. So type 1, this is for the gas exchange. This is where you exchange your carbon dioxide, your oxygen, all of that exchange here at the type 1. This is a squamous cells, squamous alveolar cell, which is right here, type 1. Type 2 is where you secrete the surfactant. Surfactant, okay, is type 2. Okay, type 2 surfactant is to help make your lungs nice and smooth, reduce any type of frictions, reduce friction. One good question to remember is that surfactant is actually released at the 26 weeks of pregnancy. 26 weeks of pregnancy. So if you're pregnant, if you're preggo, and you have a preemies before 26 weeks, so chances are would be your baby will have harder time to survive because they don't have that surfactant. So your baby will be intubated, will be in the intubated because they cannot breathe on their own. Okay, so surfactant is very important. So after 26 weeks, most likely baby actually could breathe on their own, and they actually have a higher chance to survive. Prior to 26 weeks, the chances are it's kind of like flip a coin. It's 50-50. Your baby could actually die. But after 26 weeks, the chances for your baby to survive is much higher. So keep that in mind. Last one is alveolar macrophage. Macrophage is the dust cell, which is this little guy here. Dust cell, this is for your immune system. So this, think of it as patrol guy. This is a police patrol, making sure that they see any bad guys, they kill it right away. Just arrest them, kill them, send them to jail. So that's the alveolar macrophage. Type 2, again, that's creating lubricant. Make sure, nice and smooth. Just lubing your lungs. Okay, just loop the lungs. So type 2, you loop the lungs to make sure your lungs is nice and smooth. No friction. You don't want any friction. You want to go nice and smooth. Okay. Type 1, this is where you exchange the cells. This is where you exchange the gas. So 1, exchanging the gas. 2, just make it loop nice and smooth. So So pleural cavity, this is something you should know for your lab as well. You have 2 layers of pleural cavity. You have the parietal. Parietal, again, is on the outside. Parietal, think of like box when you open up your iPhone. You buy your iPhone, it comes with this box. The box is pretty hard. So the parietal is the box that actually protecting the iPhone inside. Visceral is the sheet that covered the iPhone itself. This tiny little plastic stuff that you cover the iPhone. That's the visceral sheet. So always think of that way. And between the parietal and visceral, there's actually a pleural fluid. There's actually a fluid inside there to actually help reduce any friction when you breathe. Your lungs expands and then collapses, expands and collapses. So those fluid makes it a lot smoother. And this is to also bring to the last part, is where you actually compartmentalize, meaning that each section is pretty much capped, just kind of well wrapped. Just think of it like your, let's say if you buy accessory or you buy any big huge gadget like your TV, for instance, when your TV is in the box, it's nice and well wrapped for each section. The TV itself is wrapped, the stand itself wrapped on a separate sheet. So your lungs and your heart pretty much that way as well, your brain as well. It's compartmentalized, meaning that it's wrapped with each section. So each section is actually wrapped, has its own little sheet to wrap around it. So to make sure it's nice and pristine and nice and smooth, doesn't actually cause any friction to one another. Okay? Okay, so I believe this is it for this video, and then I'll put up another video in regards to the breathing section. Okay, see you on next video.